Hi.
My name is Godwin. I'm going to be your nurse today.
Oh, nice meeting you, Godwin.
Nice to meet you too. Can you tell me what we're going to be doing here today?
Yeah, I'm here for physical assessment and tutorial assessment.
Okay, so I'm going to help you out with that, okay?
All right, thank
All
you.
right, so I'm going to go ahead and wash my hand. I'll be right back.
Oh, okay.
So I went to the bathroom, I washed my hand, so I'm gonna go back and meet my patient. So I'm gonna cover the corner to provide privacy. All right, Ola, can you confirm to me your name and date of birth?
Yeah, my name is Tola Dotun Alade. My date of birth is February 9, year 2000.
Okay, so I'm gonna check the name you told me to corresponding with the wristband, so they correspond. Okay, so Ola, can you tell me what the month and the year?
Yeah, this is 1st of July, year 2024.
Okay, can you tell me the President of the United States?
Joe Biden.
Can you tell me where you are right now?
We're in Florida.
Okay, so my patient was able to establish his alert and oriented times 4 by providing the name, the month, and the current president and where he is. All right, so Ola, are you allergic to any latex?
No, not at all. No
Okay.
allergy.
Okay, so I'm gonna go ahead and put on my glove. My patient confirmed he doesn't have an allergy. Okay, so Ola, do you have any pain?
No pain.
No pain?
Yeah.
Okay. All right, so my patient confirmed to me that he doesn't have pain. If he had told me, I would have proceed with further pain assessment. Okay, do you have any tingling or numbness?
No tingling.
Okay, no numbness, no tingling.
Yeah.
Okay, so he confirmed no numbness, no tingling. Do you have any dizzy?
No.
Okay, so what about your mobility?
Yeah.
Okay, can you stand up for me?
Right.
Okay, can you come toward me? Okay, move back. So I was able to confirm that my patient mobility and the gait is okay. So I'm gonna go ahead and inspect my patient's scalp. Okay, so when I inspect it, there is no any bruise, no opening on his hair, no infestation. So I'm gonna go ahead and do the. I'm gonna go ahead and do the eye, the. So I'm gonna go ahead and do the eye, the vision. Okay. Okay. Can you follow the direction of this? Okay. Okay, so I was able to confirm that the ocular movement of my patient is okay, and his sclera is white, the iris, the sclera, everything looks good to me. Then his the pupil is equal, round, reactive to light and accommodation. Okay, so I'm gonna go ahead and inspect my patient ear. So I'm gonna pull this out and backward. So there is no drainage. The tympanic membrane looks good to me. All right, so I'm gonna inspect the nose. The nose is at the midline. Okay. So when I check the nose is at the midline. There is no drainage. There is no blockage. There's no blockage, no drainage noted in the nose. So can you pull out your tongue for me? Can you wiggle it around? Okay, so my patient, the tongue is on the midline. Then he was able to move it around. The oral mucosa is moist and the oral mucosa is moist and pink. Okay. So can you puff? Can you smile? Okay, can you smile? Okay, can you puff your cheek? Okay, can you frown? Okay, so I was able to establish the cranial. Oh my goodness. So I was able to establish that the cranial nerve face of my patient is good. Okay, so I'm gonna go ahead and check the carotid and jugular vein. Okay, can you lay down? So I'm gonna make him to lay down 45 degrees. Okay, can you bring your shoulder up? So I'm gonna pretend there is a kilo behind him. So when I inspected his jugular, there is no jugular vein. The carotid artery is bounded. Okay. So I'm gonna check. Okay. So I checked his skin toggle is okay. It's normal. So I'm gonna go ahead and check his lung sound. So I first inspect the wall, the chest wall of my patient. Looks good. There is no any swelling, no bruise. Check the behind. Then there's no swelling, no bruises. Can you breathe in hard for me? Okay, breathe in hard. Breathe in hard. Hard. Okay, hard. 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 Okay, so when I checked my patient, the breathing sound, the anterior and posterior, the lung sound was clear. So I'm gonna go ahead and check my patient valves, the cardiac valves. So when I check my patient cardiac valve, the pulmonic valve, the S2 of the pulmonary valve is louder than S1. The aortic valve, the S2 is louder than S1. The EPS point, the S2 is louder than S1. Then the tricuspid valve, the S1 is louder than the S2. Then the mitral valve, the S1 is louder than the S2. The apical pulse is 70 beats per minute, so it's regular. Okay, so I'm gonna go ahead and check the capillary refill of the extremities. Okay, so I'm gonna check the foot one. Okay, so the capillary refill of the whole extremity is less than 3 seconds. So can you pull out your hand for me? Push it like this. Okay. Can you do like this? Can you do like this for me? More like this. Okay, what about this? Okay, what about this? Okay, this way. Can you wiggle your feet? Okay. Okay, can you do it like this? Okay, this one. Okay. So when I check my patient extremities, the range of motion, the upper extremity is normal. The range of motion for the lower extremity is normal. Then he was able to roll around his feet and legs. Then the capillary refill is normal. It's less than 3 seconds. Okay. So can you lay down fast so that we can do the bowel sound? So I inspected his abdomen is flat and non-tender. Any pain?
No pain.
No pain?
No pain at all.
Okay, so sit up. So when I check my patient abdomen, there is no tenderness noted. The bowel sounds is active in the whole 4 quadrant. The right lower quadrant, the left lower quadrant, the right upper quadrant, and the right lower quadrant. The bowel sounds are active. There is no any pain noted. Okay. So can you tell me when the last time you voided?
Just now.
Okay. So can you tell me the color?
The color is clear yellow urine.
Any pain noted?
No pain.
Okay.
No difficulty.
Okay, so do you have any nausea, constipation, vomiting?
Not at all.
Okay, so my patient denied nausea, vomiting, constipation, so he voided this morning. The color was normal color, and the consistency was normal consistent for stool. So I'm gonna check his gastrourinary system. So when was the last time you voided? Today. Okay, what was the color?
Clear yellow urine.
Okay, so can you tell me do you have a problem urinating? Okay. So are you incontinent?
Continent.
Continent.
Of both urine and IPM. So I had PM this morning. as well.
Okay, so when was the last time you went for your prostate test?
Oh, not yet. I'm not yet up to 40.
Okay, so my patient confirmed is not yet up to 40, so there is no need for the prostate inspection screening. So he told me that he voided this morning, and the urine was yellow, no pain while he was urinating, and the color was normal color, yellow color, and also he confirmed to me that his BM was normal, consistent, and also had a BM this morning, so no nausea, no vomiting. Okay. So I'm going to check my patient pulses. So I'm going to start with this, bilateral. Okay, I'm going to do this one, and this one. Okay, so I check the pulse, my patient pulses. The carotid pulse is bounding. I checked his popliteal. The popliteal pulse is bounding 2+. He's bilateral. I checked his peto, the dorsal and the posterior. They are bounding 2+. The antecubital pulses, they are bounding 2+, and his radial pulses, they are bounding 2+. Okay. So when I checked his skin, there is no rash, no TED, no bruise, no swelling on his skin. There is no any pressure ulcer. There is nothing going on with his skin. It is normal to ethnicity. Then is a skin toggle. So the skin toggle was normal and elastic. Okay. So you can hear me very well, right? Okay. So is there anything else I can do for you?
No, I'm all set.
Okay, so we have come to the end of the assessment on my patient. Thank you.